Just like SATA questions, prioritization questions on the NCLEX exam are among the high difficulty level questions you can get. And if you are getting those, you know that you are at least on the right track. So today, guys, we are going to look at prioritization questions as part of the NCLEX series. So let's get right into it. Hello guys, welcome back to another video. If you are new here, hi, my name is Faith, and on this channel I talk more about nursing and general leveling up. What I'm doing right now, I'm trying to level up my career by relocating and going to practice to the US, and I believe that I'll be able to advance more there and practice better. So guys, if you are new here, welcome, and if you are returning, thank you so much for your support. Please continue to subscribe, put on the notification button so that you don't miss any upload when I upload, because these videos, I know they can help someone. I know they'll help someone. So welcome, and let's discuss prioritization questions today. So guys, you know NCLEX questions needs critical thinking, and on your exam, most of the time, trust me, on my exam I got at least 45% of the questions were prioritization questions. So you'll get most of them because they need critical thinking for you to handle prioritization questions. That's why it's very important for you to think critically and to know which patients you should prioritize to see on your questions and which ones are of a less priority. So today I'm going to give you, sorry, I'm looking down because I've written them down. I did the NCLEX some times back, and yeah, some of these things need refreshment. So today I'm going to give you at least 5 strategies that you can use when answering prioritization questions. And guys, watch up to the end because there is some bonus that I'll give you that is very important, that will help you easily rule out a wrong answer. So guys, let's start with the first trick. So guys, the first step or strategy that I want to give you is as simple as a stable patient. Stable beats an unstable patient. Yeah, you'll see a question written that the patient is stable, or no, the answer's written that this one is stable, this one is unstable. They use the exact same, those exact words. So if they tell you that this patient is stable, the patient is stable. Don't even think about it. That's a low priority patient. If they tell you this patient is unstable, yeah, the patient is unstable, and that patient goes to a high priority patient. So it's just up to you to know which patient is stable and which one is unstable. And at the end of the video, as I told you, I'll give you a bonus. I'll be talking about those patients, the condition that when you see, or a symptom that when you see is occurring, you automatically know this patient is stable or this patient is unstable. So it's as simple as that. If the patient is stable, they are a low priority. If the patient is unstable, they are a high priority. So stay tuned for those conditions that specifically I'll tell you are the low priority and the high priority conditions. Okay, let's get into the second trick. So the second strategy is the chronic versus the acute. Yeah, guys, it's as simple as that. If you see someone or a condition that is chronic, that patient is stable most of the time. The patient is a low priority patient. Yeah, if you see a condition like chronic heart failure, COPDs, if you see such a condition, that person most of the time they are a low priority, unless the questions add something in the modifying phrase that shows that this person may be unstable. Let's say they have COPD and they have shortness of breath, not really shortness of breath, which is the best. Yeah, let's say they tell you this guy is a COPD case, but then they are bleeding. Yeah, now that takes them to a high priority. But if you just see a patient with a chronic condition, the congestive heart failure, the COPDs, those most of the time are low priority patients. And the acute patients are those patients that the conditions are acute. Yeah, right? Like appendicitis. Yeah, they tell you most of the time, the questions just tell you the patient came in with acute, yeah, or this patient has, let's say, acute appendicitis. That patient is a high priority patient. They are not stable. Yeah, so if you see an answer that has acute conditions, those are high priority patients. If you see a chronic condition, those are low priority patients. Yeah, let's get into the third trick. The third strategy is the fresh postoperative and the other surgical patients and the medical cases. Yeah, if you see a patient, a question that the patient came in 1 hour, 1 hour postoperative, let's say just 12 hours postoperative, before 12 hours postoperative, right? That's a very high priority patient. So you see a patient that came in a day later postoperative, yeah, the patient has been 1 day postoperative, 24 hours postoperative, that now becomes a lower priority patient. And also the fresh postoperative patients, they usually beat the medical cases. Yeah, if they tell you this patient came in an hour ago from surgery and there is another patient with diabetes, yeah, that patient with diabetes is a low priority patient. The patient that came in an hour ago postoperative can change condition anytime. Yeah, they need assessments, they need close monitoring. That's a high priority patient. So fresh postoperative, they beat the more than 12 hours postoperative, they beat the medical condition. Yeah, that's another trick that you should know when you're doing prioritization question. So let's get into the fifth strategy. The other strategy that I want to give you guys is the expected versus unexpected symptoms, right? Yeah, so you have this patient, and for you to apply this one, you have to know the conditions and how they present. So if you have a patient with this kind of condition, diagnosis, you should know the expected signs that the patient will present with. And if you have this condition, you should know the unexpected signs the patient is not supposed to present with. So if you see a patient with this particular condition and they present with something unexpected, something that's not a symptom of this condition, that is a very high priority patient, right? So if you see the answers and this patient has, let's say, hepatitis, and they have jaundice, that is expected with hepatitis, so that is a low priority patient. And if you see maybe a patient with, let's say, just that hepatitis and they are having breathlessness, that's not expected. So we definitely know this is a high priority patient. So expected versus unexpected. Go to your conditions, know your conditions, see, is this expected, is this symptom not expected, and get the right answer. So this next strategy is a general strategy, and you'll realize that when I'm talking about this, I might even again cover the first strategies that I've given you. Yeah, so this strategy entails the airway breathing, the MASLOWs, and the nursing process and all those, right? Let me check. Yeah, so if you see a questions, yeah, I'm talking about a prioritization question. These questions are usually, you'll just spot them. They'll tell you which patient will you see first, which patient will you attend to first. That's a prioritization question, right? So if you see such questions, now you can also use the ABCs. You ask yourself, is this an airway problem? That is A. Yeah. If it's not an airway problem, you go now to breathing, right? You ask yourself, are we having breathing issues in this question, right? Or in these answer choices? Actually, you're looking at the answer choices. Are we having an airway problem? If it's not, are we having a breathing problem? If it's not, we go to circulation. Are we having a problem with circulation? Yeah. And for that, now we've covered the airway, breathing, and circulation. If ABC does not apply, you now go to other physiological needs, right? Like, is it food? Yeah, that's the fourth priority. Is it food? Is it fluids? Is it nutrition? Those are physiological needs. And if there is no physiological needs, now you go to safety, right? We are going through the hierarchy of the Maslow hierarchy of needs, from bottom up. You see that hierarchy has several needs, and you start from the bottom and highest priority. And if you realize on the Maslow, the bottom part, the high priority, there is air, right? The ABC generally are on the bottom part. Okay, that's why you are going upward, right? So if it is not physiological, now you go to safety. Is it a safety issue? Is this person in danger of maybe falling, yeah, hurting themselves? If there is no safety issue, now you go to psychological, right? Are they in pain? Yeah. Are they stressed? Okay. And you'll realize that once you applied those, you've gone through all the hierarchy, the Maslow hierarchy of needs. You've applied the ABCs. You've now applied the, if it's physiological, you've now gone to if it's safety or if it's psychological, right? And then you'll get your answer. And for the bonus, guys, those are the strategies that I was supposed to give you. And for the bonus, I'm going to give you words that will show you a patient is stable, words that will show you a patient is unstable, and symptoms that when you see automatically, even if it is expected in that condition, the patient becomes unstable. So I'll be looking down because I've written them down. So we'll start with words that shows the patient is unstable. The first word when you see in an answer, if the word says, the statement says this patient is unstable, the word unstable automatically makes that patient a high priority. The patient is unstable. Just the way they said, the patient is unstable, the patient is unstable. So the word automatically makes that patient unstable. Okay? The second word or phrase, if they use acute illness, yeah, let's say acute appendicitis, acute abdominal pain, right? Acute. If you see acute, you know that's a high priority patient. You prioritize that patient, okay? Another word, if you see less than 12 hours postoperative, if you see that this patient came in an hour ago from surgery, that patient is unstable. So that patient automatically becomes a high priority patient, right? So if you see less than 12 hours post-op, just know that is a high priority patient. And then if you see that the patient was under general anesthesia, right? That patient can change condition anytime. The patient is unstable. And this applies for the first 12 hours. Less than 12 hours postoperative. That patient is unstable. You need to prioritize the patient. Then, guys, there are lab values that when they are high or very low, you know this patient is a high priority. I'm not going to name all of them here, but you guys can look at your lab values, right? You're studying for the NCLEX, you should be knowing your lab values. And I can refer you to, there are audios that circulate about MASLOW. There is a section that he talks about the lab values, the high priority lab values, the low priority lab values. Like the high potassium is a high priority. The very low potassium, very high priority. Yeah, very low blood glucose, very high priority. So go look at your lab values, look at the values and go to your textbooks and see which ones are very high priority, which ones are very low priority, and determine. If you see lab values that are very high, yeah, especially the vital ones, I think I should do a video about that. Yeah, if the patient has very abnormal lab values, that will automatically make that patient a high priority. There are some values that if they are high, like the creatinine, they are not really very high priority. That's why I'm saying I should do a video on that. Stay tuned for that. And then if you see a phrase that says not ready for discharge, or newly admitted, or newly diagnosed, admitted less than 24 hours ago, that patient is high priority. They need to be monitored. It makes them higher priority than other patients. Okay? And then if you see a patient's vitals changing, right? Changing vital sign, changing condition, that is a high priority patient. Okay? If there is something new, yeah, the temperatures are changing, maybe they are going high, they are becoming breathless. The patterns were stable. Now they are becoming very frequent, or they are going down. That's something new occurring. You should make that a high priority. The other thing is, I've talked about if you see someone experiencing unexpected symptoms that are not consistent with that condition of the patient, right? That patient is a high priority. You should prioritize that patient, okay? Yeah, so we now go to those phrases that when you see, it shows that the patient is stable, okay? The first phrase is the word stable. If you see the word stable in your answers, it automatically shows you this patient is stable. So there's no much you are doing about it. The patient is stable, they are stable. Okay? Another thing that if you see a chronic illness and the statement, the patient is stable. Okay? Like congestive heart failure. Yeah. Those are stable conditions. So that patient is stable. If you see a patient that came out of surgery 12 hours ago, that's a stable patient. Okay? If you see a patient that was under local anesthesia, the patient is probably stable. That shows the patient is stable. It was just local anesthesia. Okay? If you see, there are lab values that when you see, like the high creatinine, they are not really high priority than other. I'll do something about the lab values and then you'll understand. So you should also look at the lab values. Sometimes they give you an answer with different answers with different lab values. You should know which are the high priority lab values and which are the low priority ones, right? Okay. If you see a patient that was admitted longer than 24 hours, or the statement shows that is being discharged today, ready to be discharged, those are low priority patients. Okay, they are stable. If you see that a phrase that says that their temperature has been stable, it's not changing, that is, there's nothing new occurring. That patient is stable and is probably a low priority patient. Okay, and if you see someone or an answer saying that the answer showing that the patient is exhibiting the symptoms are consistent with the diagnosis, that shows that the patient is stable. There's nothing you will do about it because it is a normal occurrence. The patient has hepatitis, the patient has jaundice, that is a normal symptoms of hepatitis. Okay, the patient is post-op, the patient has an incision and they are experiencing pain on the incision site, that is expected. You are not supposed to prioritize that patient. You'll rather go to attend to a patient who is bleeding first, and then you'll attend to the pain, because it's expected that they had surgery and they'll experience pain there. So yeah, so those are the phrases that if you see, you know the patient is stable or unstable. Okay, now let's look at the phrases or the symptoms that if you see in your answer, it automatically makes that patient unstable, even if it is expected with that condition. It automatically makes them unstable. The first one is hypoglycemia. If you are going into hypoglycemia, you are automatically unstable. Whether you are diabetic, whether you didn't eat, you are unstable. The second one is hemorrhage. If you see a patient hemorrhaging, automatically unstable. The third one is high fevers. High fevers more than 105. Okay? It automatically makes you unstable. Have I left something else? Okay. The other one is pulselessness. Pulselessness. If the patient has no pulse, the patient is automatically unstable. So that automatically makes the patient unstable. Yeah. So those are the symptoms that if you see, you know this person is unstable. Hemorrhage, hypoglycemia, very high temperatures because they are going to seize, and whatever the pulselessness. Yeah, pulselessness. Oh, I was forgetting something. Also breathlessness. If you see someone is breathless, that's a danger sign. It makes them a high priority. So yeah, and then from these things, there's something. I was listening to an audio from MASLOW, and I really used to remember that for my NCLEX. If you see someone who has no pulse, they are not breathless, they become a low priority when you didn't witness the event. Let's say an accident, and you get someone who is breathless and has no pulse. Okay, that person is a low priority. They are probably dead, and you don't treat them as a high priority. That's a gem I've given you. You might get that in the NCLEX. Okay. I think I've gone through all my notes. And yeah, those are the strategies that I have for this video. Okay guys, thank you so much for watching. I hope you learned something from this video. Thank you so much for your support. Thank you for watching, and I hope you learned a lot, and I wish you so much luck as you sit for the NCLEX. For those people who are here almost doing the NCLEX, I wish you success. It's very doable. You just have to be ready for it. Yeah. And for those people who are in the process of starting, yeah, don't give up. Just study and use my tricks, and you'll be able to pass the NCLEX. The next video, I'm going to do something on delegation. Yes, I really love delegation. Yeah, I'll be talking about delegation next. Stay tuned for that. Thank you so much for watching. Please Continue subscribing. We are now at 80 subscribers. Thank you. Continue subscribing and continue sharing this video to those people that you know might help them. And let's meet in the next video about delegation. Bye.